All right, good afternoon, everyone. I am Darnell Barrington. I am the Bridges 757 Program Coordinator and the Local Health Department Contract Monitor. So in the best interest of time here, I am going to fly solo on this one. However, I would like to shout a couple of people out. So Chrissy Schlegel is in the audience. She is our CBO Contract Monitor. She's my right-hand woman. There she is. Hey, Chrissy. And also we have in the audience, Adi Amradai. She is our community engagement specialist. She's amazing with the MSM population. And so since so far we've been talking a lot about the Thrive Project and our collaborative, as I look through the room, I also see one of our collaborative members here. So we have the LGBT Life Center of Norfolk, Virginia. Hey. All right, so I'm just gonna dive right into this. So as far as what I'm gonna talk with you about in this short 8 minutes, I'm going to talk to you about the provision of PrEP in Virginia, our PrEP navigation protocol, and our PrEP ambassador program. So just a nice little snapshot of our PrEP program. So, story time. Bear with me, please. I'm going to take you back about 5 years ago. So in 2013, there was a long waiting list for the AIDS Drug Assistance Program, which we know as ADAP. The long list was roughly about 3,000 people. So the General Assembly in Virginia gave the Department of Disease Prevention at the Virginia Department of Health extra funds to help provide medication that was inaccessible because of the shortfall of Ryan White funding to those 3,000 people. So around that time, you know, the Affordable Care Act was being implemented, and that actually allowed the Department of Disease Prevention to buy every person with HIV who met a certain income requirement their own health insurance, and also pay for their deductible. Pay their maximum deductible, which was ultimately cheaper than buying the medication on the ADAP program. So that savings was enough to free up all of the state's allocation, which our deputy director was able to keep since 2013. So that freed up money from the ADAP program now is money that we can use for whatever we choose to. And in this case, we choose to use it for the PrEP medication. So with our PrEP program, it's really interesting in that we only administer PrEP through our local health departments. So by being able to do that, we're actually able to utilize the 340B program to help subsidize the PrEP also. And so what does that mean? Free PrEP for all Virginians, yay! So some exclusions do apply. Right. But to be clear, those exclusions are, of course, eligibility criteria that goes along with being on PrEP, so whether it's medical and otherwise. But however, if you are medically eligible for PrEP, no matter your income or anything like that, we don't even take people through the billing process. If they come into a health department, we do have third-party billing in place, but we are not actively utilizing it right now. So if you make $10K a year, or if you make $100K a year, if you go through the health department, your PrEP is free. So. Kind of a recap, 340B pricing plus state funds equals what? For all Virginians, yay. And so the beauty of being able, and moving forward, so the beauty of being able to do it through our local health departments or through the STI clinics and the health departments is that we were able to, I guess, strategize in reaching the population that was most at risk, because mind you, the folks that are probably coming through the health department are young, minority, income levels are not where they're supposed to be, and we know that those are risk factors for acquiring HIV. So, and that's just like, I think it was really important to like set that tone as far as like our PrEP program and I guess the success of it, because from that we've moved on to even further reducing the burdens on individuals that are on PrEP. So another thing that we've also implemented with our PrEP program is a mail delivery program. So if a client is on PrEP and has demonstrated that they are adherent for 90 days, they are now eligible to be able to get their PrEP mailed to them, and they can pick it up at home. They get it mailed straight to their house. And the only eligibility requirement around that is that they're adherent for 90 days. And of course, adherence is one of those weird things in that the only way we're able to truly monitor adherence is if they're coming back for their 90-day checkup. But if they do that, then they are good to go. And of course, limitations with that include the fact that some people, they don't want it to come to their house. They would like the convenience of that, but they don't want it to come to their house depending on who they live with. And also, we don't allow a P.O. box. Can't use a P.O. box or anything like that. So there are some limitations around that. However, but as far as, reducing the burden, I think this is a really good, step. So Part of our service navigation process, of course, is the PrEP Navigator. And our PrEP Navigators are a bit different in Virginia in that they are only housed in the local health departments. So they also have like dual roles, not only as a PrEP Navigator, but also as DIS, which of course is a really good move in that they have access to some individuals that otherwise you may not find. So when you have like partner services and things to that effect, it makes it a lot easier to promote PrEP to certain individuals. So when it comes down to the skills or what we look for in a PrEP Navigator, we're looking for someone who has the ability to support both HIV positive and HIV negative MSM of color and accessing a wide range of services using a client-centered counseling approach, knowledge of HIV, STDs, risk reduction, prevention, and care issues, cultural and linguistic sensitivity, and the ability to adhere to a strict code of client confidentiality. And so what that translates to in practice is being able to meet with clients in the field, clinical settings, or office settings, assessing clients' needs, discussing barriers and to services and treatment. And with that also too, I think it's adherence. Like, if there's ever a situation where adherence comes out to be a problem, they need to be able to navigate that. The Navigator should navigate that. And helping clients access many different services, coordinating referrals, and supporting client transition into self-management, because we, of course, want our PrEP clients to be self-sufficient. So this is a bit of a logic model that kind of takes us through that process. And the beauty of a program like the Thrive program is that it ends up being this kind of like closed loop in that, someone may come in for testing, they can go through this process and then make the decision, well, maybe I want to be on PrEP now. And they come back through this process and, I'm on PrEP now, but I'm having issues with housing or I'm soon to be homeless. That's going to make be a major concern as far as being adherent goes. So this PrEP navigation process just kind of shows you what it's like to be one of our clients through the 1509 program. And one thing that we've implemented fairly recently is the PrEP Ambassador Program. So the PrEP Ambassador Program is a way that we kind of utilize community members to use their own social networks to spread information about PrEP services, and other HIV prevention tools and resources. These are people that are just in the community. And the beauty of it is that we actually provide them with training. So we have contracted with other people to do HIV one-on-one training with them. We've had the Greater Than AIDS with Kaiser Family Foundation to come in and do social media training, and which has resulted in a very robust program in that not only are we able to provide information to members in the community, by members in the community, but it also builds capacity because these individuals are also contracted to work with some of our community-based organizations, and they get paid. They get a little bit of money. So it's a really nice program. And actually since then too, it has also spanned out to the HIV care services side of the Virginia Department of Health, in that now we're recruiting more and more HIV positive individuals to talk about the need for, just kind of dispel myths and misconceptions about PrEP. There's been situations where there are individuals who are HIV positive and they have partners that are negative and they've been taking their medications. So we want to, like I said, be able to kind of quell that issue before it gets out of hand, because that means, one, you have someone taking PrEP using wrong medication, but also you have the issue of someone not being adherent to their HIV medications. All right, so that is it.